morning, world. I'm Dr. Nikish. I want to encourage you guys to do something positive in someone else's life today. Make a difference because we're all out here doing our best to live our best life. Today, I decided to answer questions about what is an anesthesiologist and what it takes to become an anesthesiologist. So an anesthesiologist is a physician who practices in the field of anesthesia. So essentially what that means is a physician who is a medical expert in all things revolving around perioperative care. So before surgery, during surgery, and after surgery. Your anesthesiologist is going to do a medical assessment of you, take into consideration any previous medical conditions, any medicines that you take. They are going to formulate an anesthetic plan and collaborate with your surgeon in terms of the needs for that particular procedure. And they are also going to be involved in the administration of any anesthetics. So how do you become an anesthesiologist? Well, an anesthesiologist is a doctor or physician, just like every other physician. It starts out with the requirement of a bachelor's degree, which typically takes at least 4 years to accomplish. Then you are admitted into medical school. So during your 4 years of medical school, of course, you're learning alongside surgeons, cardiologists, pediatricians, internists, the whole gamut of doctors. And after medical school is really where every doctor's career path kind of diverges as they enter into different residency programs for further specialization. Regarding the field of anesthesia, that is going to be an additional 4 years after completing medical school. So essentially 4 years of undergrad, 4 years of medical school, and 4 years of residency, which is 12 years of training to become a physician anesthesiologist. For myself, what type of procedures do an anesthesiologist do? Okay, so in addition to administering anesthetics to render people unconscious and control their pain while they're undergoing surgery, anesthesiologists also are involved in placement of invasive lines such as central lines, arterial lines, IVs, as well as epidurals, spinal blocks, peripheral nerve blocks, and of course, intubating, which is a critical part of providing general anesthesia. For myself, a typical day for me, I work in private practice, and I work as a general anesthesiologist. Anesthesiologists can, after residency, decide to further specialize their skills in fields of either obstetrics, anesthesia, which usually lends itself towards more high-risk OB, cardiac anesthesia, critical care, neuroanesthesia, pediatric anesthesia, as well as pain management. I practice general anesthesia, so I do a little bit of everything with the exception of cardiac, but there are some general anesthesiologists that do cardiac as well. But majority of cardiac anesthesia is handled by a cardiac trained anesthesiologist. So for myself, what that entails would be covering a myriad of cases. Generally, that would be, for example, urologic cases such as kidney stones, nephrectomies, prostate surgeries, bariatric surgery, general surgery such as hernia repair, bowel obstruction, ENT cases, so thyroidectomies, sinus surgeries, tracheostomies, I've talked about that before in the past, orthopedic procedures such as joint replacements, orthotrauma such as fractures, myriad of cases, even electrophysiology cases. So cover cases including pacemakers, AICD placement, electrophysiology studies where they assess aberrant pathways that are involved in atrial fibrillation and atrial flutter.